Hi there. My name is Lisa Dow, and I'm the physiotherapist behind the Keep Breathing program. We're going to talk about the Keep Breathing program, what it is, how you get involved, who is involved, what's involved in being involved, and then at the end, we're going to talk to those that are involved and see how they feel about being involved. That's a lot of involvement. Anyhow, so we're going to talk about keep breathing. We're going to talk about our successes, what we do, and then talk to the keep breathers. I'm going to share my screen so we can, here we go. Okay. So the keep breathing program, what is it? The keep breathing program is a program that I created as a physiotherapist working in respiratory rehab in a hospital for many years. It's a program that involves exercise, education, and support. And all three pieces of the program are quite important. We're going to talk about exercise first. And I know a lot of people think, when they can't breathe, that how do they possibly exercise? But really, exercise is one of the most important management strategies for people with lung disease. Because we know for people with lung disease, the fitter and the stronger they are, they use less oxygen for any given activity that they do. Their tissues become more sensitive to oxygen. Um, they need less effort for any activity that they do. So that means they require less energy or oxygen. So that makes us be able to do more with less. We know with people with lung disease, the fitter and stronger they are, it means they get better at balancing. The better your balance is, the more efficient all of your movements are. So that means for any given movement, again, you need less oxygen. It also reduces your fall risk, reduces your risk of injury. We also know that if you've got lung disease and you're exercising, that your immune system is improved. It means that you will have fewer, less severe, shorter duration chest infections. We know people with lung disease when they're exercising that they're less likely to need hospital care. They're likely to use less medications. And why is that important? Because that's important for preserving lung tissue as we move forward. We also know that exercising, getting fitter and stronger, means an improvement in general health. So it means that not only are your lungs a little bit more improved, you also have better heart health, better bone health, joint health, better metabolic health, and better mental health. All of those things are really important. Helps us to have better results long term. Helps us to be able to function better. So that's the exercise portion. Why do we do education and support? Well, if we're looking at the education and the support component, we know that it'll improve your understanding of your underlying lung disease. The education and support also provide tools for helping you manage the lung disease that you've got. It improves your confidence in your self-management. So imagine if you feel more confident about talking to your lung disease, imagine talking to your healthcare professional. You'll be able to explain your signs and symptoms better and be able to be more involved in your care. We know that if you're supported and you're educated, you're more likely to quit smoking and to stay quit from smoking. And we also know the more that you know, you're more likely going to adhere to your exercise program. So all of that relates to having improved quality of life. So what is keep breathing? So it has all those three pillars: exercise, education, and support. It's run virtually over Zoom. It's physio led by me, and it's at low cost. The important part of being low cost is we know that the programming needs to be ongoing. And because it needs to be ongoing, we need to be able to support that long term. So low cost is really important. So, what does the Keep Breathing program look like day to day, week to week? The exercise component we do live over Zoom twice a week on Tuesdays and Thursdays right now. And that exercise session will look basically like a regular exercise session, meaning that we will do stretching, strengthening, mobility, balance, and cardio. Um, but built into that exercise program is proper pacing, breathing strategies, and multiple levels to make it right for each person that's in the program. We also do lots of self-monitoring techniques to make sure that each individual understands what the right level is for them. So that's the exercise. Now, along with the live exercise sessions, we also have a full library of bonus recorded sessions. Those recorded sessions can be used if somebody has to miss a session because they have an appointment, or they're just for whatever reason not able to attend the live session. You know, there are some people in the group that actually like to do extra sessions. And, you know, that makes sense because when you're exercising and you feel better, then it makes you not be so afraid of doing an extra session because it makes you feel better. Um, the chat nights. Our education is done a lot of it through our chat nights. We meet one evening per month to chat about something that the group has found um, of interest. So, a topic of interest to the group. Sometimes it's completely respiratory related, like how to use your inhalers, talking about breathing strategies, talking about the medications we might use to manage our lung disease. But sometimes it's only marginally related, but all of the topics we talk about come back to how we manage on a day-to-day basis. Sometimes I lead the chat nights based on my expertise, but often I will bring in a professional colleague. I've been a physio for in our community, the Belleville area, for more than well, almost 30 years now. So I have lots of connections, lots of people I can call on to come and join our chat nights to share their expertise with us. The support piece is ongoing. Um, I provide support as much as needed. I'm available as needed. Um, the other part that's important for support is the support our people give each other. And then the other piece of our support is our private Facebook community that we have. It's a great place that is a safe place for our people to connect with each other and to have access to some of our resources that we use in the group. The exercise portion, where do I do it? Well, most of the classes are done at the Evolve Wellness Studio in Belleville, Ontario. You can see from the photos that I have a nice big space with a very large monitor, so I can see everybody quite well and they can hear me and see me as well. Um, so most of those classes are done in the studio, but I do have the option when I need to, just like the people in our group. Sometimes I have to work from home. So I have a home gym that I can work through. Um, there are times when we do invite the Keep Breathers to come into the studio where we can meet face to face and celebrate occasions and milestones. So that's a great opportunity that we have as well. The chat nights, who do we chat with? Well, we chat with a lot of people depending on what we're interested in learning about, but certainly we chat with respiratory therapists, occupational therapists, the lung health nurse will come in. A really important one is the our friend, our psychotherapist who comes in and talks about anxiety when you can't breathe. She's a really great one. Pharmacist has been with us a number of times, our dietitian. We have had the COPD athlete. He is a gentleman that is from Australia with severe lung disease on oxygen that runs marathons. He does that to promote awareness of what people with COPD can actually do. Um, we also have had other physiotherapists with other specialties come and talk to us. Most importantly, though, we chat with each other. We can chat about a lot of things with each other. The resources that come from our chat night are very many, very many. So the some of them are completely related to um, the respiratory part of the program, like how to do some of the breathing techniques, the coughing techniques, the positioning for when you're short of breath. Um, but we also have resources about improving sleep, about your diet. Um, couple of the other really important pieces, though, are the ones that we use to prepare for appointments. So, preparing for a doctor's appointment, nurse practitioner appointment, talking about where we are with our respiratory health, having a good idea of what we're managing, what we're having trouble with. And then, if we prepare ahead of time for those appointments, it makes the what we get out of the appointment so much more fulfilling. So there's a lot of different resources that we have. So I just thought I'd show you a closer look on a couple of them. So one of them is about quitting smoking, how to help curb some cravings. And then the other one that I'm showing you is the one that we use to talk about our inhalers. So before we go to the doctors, kind of just reviewing what inhalers we're on so we know what we're on, and then thinking about how they're working for us. And that helps the you and your doctor talk about what's going to be best for you going forward. So the Keep Breathing program, does it work? Well, our numbers certainly say that it does work. Our first class was December 2020. Everybody remembers that, the height of the COVID pandemic. That's sort of the reason why we have Keep Breathing. From that first class, we still have 60% of that class still attending. Over the almost 4 years now, we've had over 900% growth. We get over 300 attendances per month. Um, of the classes that are available, 70% of our program participants attend more than two-thirds of the classes available a month, which is huge. Of all the attendances possible, 80% of them are filled. So, what does that mean? If you look at regular gym class, fitness class attendance, um, usually it's less than 30%. So, considering that this is a group of people that are older, using technology, and have a chronic condition, having greater than 80% attendance is really quite phenomenal. They're amazing. Who should be part of Keep Breathing? Well, anybody living with chronic lung disease. The main groups are COPD, asthma, and pulmonary fibrosis, but we certainly have lots of other people with other types of respiratory diagnosis like bronchiectasis. We've got a growing group of pre and post lung transplant participants. They're a great motivation, hard workers for sure. And we've had some post COVID and some post lung cancer treatment uh, clients in our program. So basically, anybody living with lung disease can benefit from the Keep Breathing program. How do you get to us? How do you get involved? Well, you can um, go through your family doctor, your nurse practitioner, if you like, um, or you can self-refer. If you're a referring physician, a referring nurse practitioner, what I find works the best is for you to fill out the referral form and fax it to me or email it to me, and then I contact the client. Remembering that when you can't breathe, it's terrifying to even think about joining a program, particularly one that involves exercise. So if I can do that initial reaching out, that tends to have a little bit more success than having to rely on the client to, build up the nerve to call me themselves. So, what happens when I get a referral or somebody contacts me? We chat on the phone. We chat on the phone. We talk about their present condition, how they're managing with their lung condition, how they got to where they are, and where they want to go. So what their goals are. We talk about their other um, possible medical conditions, anything that might influence how they participate in the program. Um, I do a lot of review of what they know about their lung condition and then start the teaching process right there. We talk about how they monitor how they're doing in a particular day, um, how they're going to monitor themselves when they're in the program. So teaching can start in that first interaction. I usually contact the person within 48 hours. And that initial phone call can be anywhere from, 5 minutes to an hour and a half, depending what the needs are. If somebody is interested and they're a little bit leery about the technology and they've never used Zoom before, I've done many Zoom trials with people, just making sure that they're comfortable getting on and off Zoom and um, that they're comfortable starting the camera, getting their audio to work. So often, before somebody even comes to their very first class, we will have had 2 hours of interaction together. This is some of us. Um, we are a fun group, a very welcoming group. Um, we look like everybody else. So don't ever be afraid of joining us. And our honorary keep breathers in the bottom corner, that is Russ, our COPD athlete. So you might be wondering, programming is at low cost. How do I keep the program going? Well, I'm involved in a lot of different things. I have recently started our Intro to Keep Breathing program, which is a virtual pulmonary rehab program that I run out of one of our regional Ontario health teams. It is a full pulmonary rehab program with exercise education and support. And then I also run a program called Keep Moving, which is for anybody who's over the age of 55 and wants to keep working on keeping moving as they go forward in life. So we work on strength, mobility, balance, and conditioning. It's also fairly low cost. And then I'm really involved with, pardon me, World COPD Day, where I do a lot of public education, meet a lot of people, share my expertise. I work with Healthcare Excellence Canada. I've done two big projects with them. One was providing appropriate virtual care, and the other one was working on innovations in healthcare. Those were two interesting projects. And then I've also worked with the Lung Health Foundation, working with their Fitness for Breath program, doing some consulting with them to help them improve their programming. They've also recognized Keep Breathing as one of their ideal program formats, and I've done lots of teaching for them. So, along with Keep Breathing, we're doing a lot of other things to keep going. Um, Special thank you to Jessica, the owner of Evolve. Without her and her dedication of time and space to the program, we probably wouldn't be able to say we're still going at the almost 4 year mark. Um, and also, I have to say thank you to all of the Keep Breathers who show up and work hard and participate day after day after day. I'm going to stop my share and I'm going to invite the Keep Breathers to unmute themselves. There's a few of them, quite a few of them with us today. And they're going to, if they feel comfortable, share some of their experiences with the program. Welcome, welcome.
Thank you.
So, so thanks for being here. So I don't know how you want to do this, but I thought one of the first things that I want to just sort of put out there, one of the first sort of barriers people might think about when they think about this type of program is the technology, and you know. I'm not a techie at all, and it took a little bit of time of sort of getting comfortable with the technology. Does anybody want to sort of comment on their experience with Zoom? you know, what do you think about having the program in this, using this technology? Is it a barrier for you?
I
No,
think
I
it's a good
think it's
idea.
great. I wouldn't be part of this because you're in Belleville and I'm in
Right,
Toronto. So
Oh, wow.
right,
I'm
Yeah.
thrilled that it's available
Yeah.
on
Yeah.
Zoom.
right. And isn't that a great thing that we can do it with technology, right?
Yeah.
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 Yeah, yeah. The other thing that I'd like to say with doing it in this format, it keeps when we started, it was COVID times, right? And we were all so afraid to be out amongst the people. And this allowed us, in a very safe way, to interact and do the things that we know we needed to do for our lung health, but in a very safe way.
Yeah.
Even now, if you feel you've got a cold coming on or something, working from
Mm,
home, you're not worried about infecting anybody
Yeah.
else. So
absolutely,
that is a
absolutely.
big bonus.
Yeah, and I think recognizing that there are so many things that can get in our way of doing what we need to do, that having the opportunity to do this in a very simple way, doesn't, in some ways, it doesn't allow us the excuse of not doing it because it is so convenient, right?
Yeah.
Absolutely.
Yeah.
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 Because
I feel guilty if I miss because I don't have to get dressed, go drive, pay for parking,
yeah,
find the room. It's like if I
Right.
miss a day, that's just like,
then that just puts more stress on you if you're thinking, oh, I got to get dressed, I got to get there, and you're looking at
Right.
time.
yeah.
Right. And
This
that
way,
that that's a really interesting thing too when we talk about the cost of the program. Um, you know, when you have to go someplace and pay for parking, when you have to go someplace and think about the stress of finding a parking spot and walking in, right? You
Yeah.
know, when you think about sort of all the things that you don't have to pay for when you do it from home.
also, if
Kind
you're
of
not,
nice.
you don't have to rely on someone getting you there if you're not
Hmm.
able to drive for
True
whatever reason,
enough.
and
True
that
enough.
person's waiting for you, whether it's a volunteer from community care or your partner, whatever. It's
Right.
it's putting on somebody else, and you're relying for them to be able to get you there. This way, you just go from
Right.
point A to
Right.
point B in your
Right.
home.
Yeah. The other
Yeah.
thing with the other thing with the cost is, I challenge people sometimes when they're worried about the cost to think about, well, what if you didn't have to use as much Kleenex in a month because you weren't coughing up
Yeah.
as much? What
Ah,
Yeah.
if, what if you didn't have to use as much over-the-counter cough medicine, cough drops?
Mm.
What if you didn't have to use as many puffs of your inhaler because you were stronger and fitter and more efficient at working? And then what if, after all of that, you also felt better, right?
yeah,
So the cost, like when I look at our cost, when I break it down, it works out to be, I think, $1.16 a day. Well, you guys are certainly worth $1.16 a day,
Wow.
right?
Yeah.
Feeling better. Yeah, yeah.
I have belonged to both gym and this program, and I'll
Mhm.
tell you, I've stuck with this program a lot longer than I stuck with the gym.
yes.
So why do you think that is? So what do you think is unique about, because we do have excellent adherence. So why do you think that is? What do you think is special-ish about the program that makes you want to show up?
I
You
think
do it.
doing it on Zoom, you
Okay.
don't have to, and
So it's
especially in
convenient.
our winter weather. Like I
Yeah,
don't have to go clean the car off or go anywhere, and it's
true.
just
True.
turn on my computer and there we are.
Yeah.
Yeah. And when
So
I
it's
have a low day or I'm not feeling really well, I
mhm,
still I still sign on and do
Yeah.
the class to the best that I, do what you
yeah,
can with the day that you've got. If I had to drive somewhere and do this, I wouldn't go on those days.
Yeah.
But
right,
because it's
right,
Zoom and I'm in my home and I can be comfortable and okay,
right,
I do it. I
right,
still do it.
Yeah.
right. One of
Also,
the
I think
things,
because we all have similar conditions and we support each other, so we feel very comfortable. We don't feel
mhm,
threatened or intimidated. You go into a gym, Nobody talks
Right.
to anybody, and they're doing their
Right.
thing and everything. They're blah blah blah. But here, we can just go at our own pace, and it doesn't matter if you're
Right.
slower than somebody else or somebody else is doing something that you're not quite able to do. It doesn't
Right.
matter because you're just doing what's best for yourself, and everybody
Right.
encourages each other. And as you say, if you have a low day, somebody always seems to pump you up, and I feel afterwards energized, after getting
Right.
group and that. So
We
that's a big
support
Right.
each other big time.
yeah. And it's
Yeah. Yeah.
Yeah.
the mental,
Yeah. One
emotional
what
part of it as well as the
right.
physical
One
part.
one of the things that I I was not a techie person, and if somebody told me 6 years ago that this was possible and that this actually works, I'd be like, come
Mm.
on. Because I was so used to having my group sit around a table and be shoulder to shoulder. And I really saw the benefit of being shoulder to shoulder and talking around a table. So it often, like, it just blows my mind how you guys connect with each other. You know each other's names. You know what you're doing in your lives outside of, the short periods of time that you're together. You connect with each other through our Facebook page. Some of you go and have lunch together. Like, it's just
Yeah.
so amazing that those kind of connections. And you notice, that's the other thing I kind of think is really cool, that you guys notice when somebody hasn't been there and you are interested in, well, where are they? What can we do? How
Yeah,
can we get them to come back? What's happening? So the part that I was worried about when I was, other than the technology, as I was sort of tiptoeing in here, would we have the same connection and results? And certainly. It blows me away how well that part has actually worked. Yeah,
Yeah.
yeah.
Well, I think too, the fact that we are all sort of whatever it is, we're in the same boat. It's
Mm,
very difficult because people in our lives, our families and our friends, they don't get it, right? They don't
no,
understand it. They aren't living
hmm.
it, but they're trying
Yeah,
to be
it's
supportive. But with
yeah,
us in this group, we all get it and we
yeah,
can support each other on a completely
yeah,
different level.
yeah,
yeah,
And
yeah,
that's so important and so
yeah,
amazing. It's amazing.
yeah, yeah.
Yeah.
The other thing that I really appreciate is how invested you guys all are in knowing. Knowing what's going on with your respiratory health, knowing what treatments are available, what might help for you, what you're interested in, what's new, what's coming out, interested in learning, and participating in all the things that can help you as you go forward. Um,
Yeah.
what do you guys think about, like, the chat nights? Is that something that you find is worthwhile? Do you have a favorite one that we've had? We've had a lot.
Mm.
I enjoy them. I
Yeah.
found them very informative in that. Some I know
Mhm.
I've missed, but I can go back to look
Yes.
at them and listen to.
Yes.
So yeah,
Yes. We have a whole
absolutely.
library of
Hmm.
recorded chat nights where you can go back and revisit or watch one that you maybe weren't able to be part of, for sure.
I love chat nights. I consider them a bonus for this group.
Yeah, me too.
It
Yeah.
doesn't matter
And
how much you know, you always learn from a chat night,
Yes.
for
Absolutely.
sure.
absolutely,
Exactly.
absolutely,
So,
Yep.
absolutely. And sometimes, we start talking about subject A and
yeah,
we go all the way around to subject QRS, and then somehow we end back up at A. I don't
yeah.
know how we
And,
do it,
I mean, you can
but
read as much as you want, but someone standing there telling it to you is a
yeah,
lot better than
yeah,
just reading it.
yeah. And the other
Better
part of
understanding all the way around.
absolutely, absolutely. And yeah, sometimes hearing somebody else either talk about something in a different way or hear somebody else's experience with whatever the topic that we're talking about, um, can be so, so meaningful. Have you used any of the resources like the How Am I Doing Today resource or any of the other things that have How to Climb the Stairs? There's one of
Oh,
that
yeah.
resource. The coughing, how to breathe properly, all those things. Have you had a chance to look at any of those?
I have. I've printed them out and stuff because
Oh, good.
I've had COPD for 10 years, but there's things on here that I didn't know. Now,
Yeah.
sometimes when I was going through the Facebook and all the groups, I'm like
Yep.
overwhelmed with how much
Right.
is there. And it's sort of
Right.
like I get anxious.
Don't
So
get
I think,
anxious.
okay, just back off. You mean,
One
it's
thing
there,
at a
it's not
time.
going anywhere.
That's
So
right.
yeah, but I love those things about the cough. And when you
Yeah.
put on about that ad for an oxygen concentrator that was so small and I'm like, oh, that'd be good. And then I read how it's not true, right?
Mm-hmm.
I'm going,
Mm-hmm.
that's so unfair to people that really would like
I
a
know.
smaller concentrator.
I
You get
know.
your
There
own
are,
stuff.
there
All of
are,
us.
Yeah.
yeah,
So
yeah,
I'm really happy when they
yeah.
did that.
Yeah, so I try and post things that are of pertinence to the group. And so what Beth is referring to is there was unfortunately an ad that was posted somewhere in Facebook with our friend Russ, using his image, and it was
Oh,
totally a fake news, fake news. So luckily we were able to kind of
And
look at that and go, just because it's on Facebook
no,
doesn't mean it's true.
Or
Yeah.
Instagram or
yeah,
Or
put
Twitter.
any of those
on
things.
Yeah.
And
contact
that's the great
your.
thing about this group is,
Mhm,
people will bring things to the group and they'll say, "Have you heard of this? What do
mhm,
you know
Yeah.
about that?" And then collectively we can sort
yeah,
through some
or
things.
contact your oxygen supplier. That
Hmm.
whether see, ask
Hmm.
them because they would be aware, I'm sure as well.
Oh, absolutely. And one of the nice things is I feel absolutely 100% confident, comfortable talking to many, many of my colleagues about anything you guys ever ask, because I've been around a long time, so I can call up, the pharmacist, I can call up the dietitian and just say, "What do you know about this?" And they'll help to steer us in the right direction.
Oh,
Yeah.
great.
Yeah.
Oh, good.
Anybody else have any other experience they want to talk about? How maybe being part of Keep Breathing has changed their outlook or changed how they're managing day by day?
I think when I first started, um, 2.5 years ago, roughly, um, I my oxygen, everything was really bad, and that wasn't great. But I felt sort of I can't keep up with the group. But then I realized I don't have to keep up with the group.
Yeah.
I just do what I can on the day that
Mhm.
I've got. And
Yes, that's one of our mottos.
once I got my head around that,
Yeah,
it was better. And it's just everybody just made you feel welcomed, which was
good,
really a bonus because, as I
good.
say, previously you go into a gym, nobody says hello to you. Wow, welcome to this or whatever, right?
Yeah,
You're there and
yeah,
you just
yeah. Can
wing it
can
on your own
anybody
sort of thing.
can
But
can
there's
anybody sorry, I don't mean to cut you off. Can
no,
anybody identify like one sort of functional thing that they can do now that they couldn't do before?
Yes, I
Either
can.
because either because they've learned how to pace themselves or prioritize themselves, or they're physically stronger. Carol, you go.
Last May, I did a walk for the cause, and I've
mm,
never done it before. I had my oxygen on, I had my walker, and I
Yeah,
did 2.6 miles.
which is
yeah, yeah.
fantastic.
And I couldn't walk that far before.
There you go.
Yeah.
Yeah,
amazing.
that was an amazing inspirational day.
Yeah.
That's for sure. That's for
That
sure.
leads me to a question. You
Yep.
have the two exercises like twice a week. Are we
Yep.
supposed to be doing an hour a day, like on our own too?
Well, ideally we do 3 times a week.
Oh, okay. I thought
Our
it was
our
just two.
people, Yeah. Well, and the third one could be the recorded exercise session,
Okay.
right?
Okay.
Or the third one could be that, going for a walk or doing yoga or doing whatever you can. Obviously, if we can get, Health Canada says 150 minutes.
Yeah.
We've got 120 with our 2 classes.
So
But
you
if you,
don't, I mean, do you encourage like doing it,
uh,
not maybe not an hour, but
yeah,
something every day? Yeah.
a little bit. It's so focused exercise 2 to 3 times a week, and then moving your body in some kind of way every day, right? And so that might be for you guys, moving your body might be going to all your appointments, right? Walking through the hospital. It might be more sort of a functional flair, you know what I mean? Rather than, but we do want the focus exercise 2 to 3 times a week, 3 times if we can. Um, sometimes we take what we can get.
Even your like
Yeah.
housekeeping and that, whatever you can do
Yeah.
with that,
Yeah.
whether it's dusting, swiffing floors, or
Mhm.
light vacuuming, whatever, making your
Mhm.
bed, showering, all
Laundry,
that. It's
laundry.
all, yes,
Showering. Oh my
yes,
God, that's
Yeah.
exercise.
yes.
Yeah.
Yeah.
Yeah. Yeah.
Especially with
So,
oxygen, because
yeah.
you should wear it when you shower, so
Mhm.
you don't drain yourself of your oxygen.
Right.
And
Right.
Yeah. And that's an important point about
mhm.
pacing yourself, right? Making sure that you have enough energy to do the things that you need to do, but also the things that you want to do, and you need uh, in the need and want should be exercise, should be included in both of those categories. Um, so trying to make sure that you have that energy to focus on it at least twice a week if you can, 3. Yeah. Does anybody have any other? Let me just sort of see. If you had to say what your favorite part of Keep Breathing, what would it be? Oh, Susan.
Mine.
Friendship.
Sue's excited. What is your
Yeah.
favorite part?
Well,
Lisa,
it's the support and the actual, well, what it has done for me is to change my entire mindset about having COPD, severe COPD. I don't feel like I'm on death's door anymore.
Good.
I feel like this group has given me some positivity,
Mhm.
and it's been such a great thing for me and for my mindset, for my mental health. And
there goes our
that's the biggest
wacky.
thing that I've got from this. I'm not a great exerciser. I never have been, and I plod through it. But it's the support and the fact that I keep coming back. So it's doing
Yeah,
wonderful things for me
good.
and my
Yeah,
mental health. So that's
Can you
a
hear
great
me?
thing.
yep, I can. Do you want to say something, Glenn? Your picture's frozen, but
Oh, he's
Oh,
frozen.
he's
oh,
disappeared.
he's
There he
coming
is.
back. There he is.
Can't.
Oh,
Okay,
does
Glenn.
somebody else have something they want to say while we wait for
It's
Glenn
sort of
to
the same
thaw
thing,
out?
camaraderie and everything, and the support we give each other. It just,
Mhm.
even if you're having a down day, you
Yeah,
come away feeling better. So,
yeah, yeah. The exercise is a very important
mm,
part, but really, it's all the other stuff that
yeah,
that fills it in, right?
yeah.
Yeah. Oh, Glenn, you're back. Do you want to say something? What's your favorite part of
Yeah,
Keep
my
Breathing?
internet is.
Okay.
You doing your classes. The way you explain how you do your classes and how you look after all your customers per se and all your
Oh, that's
students.
nice of you to say.
And you've got you've got a great resume, that's for sure. If you ever decide you wanted to put in a big ad someplace, you'd go a long place.
Yeah,
Mm.
yeah.
I think you're
I
great.
just,
And I think you're great. I think everybody
oh,
that's
thanks.
associated with you
Yeah,
and doing what we're doing here,
absolutely.
following
Mhm.
you or doing,
We're a
and you're
team,
doing
aren't
such a
we?
good job. You
We're
know,
a
Yeah,
team. We're a
Yeah, but you're
team.
our
we're a team.
leader.
yeah. Without you, Lisa, where would we be, honestly?
Wow.
Because
Wow.
no,
You're our
you,
fearless
as you
leader.
say, you
It,
started this almost 4 years ago, and when you
Yeah,
hear the
Everybody,
numbers and everything, that's just incredible. So
yeah, it is.
thank
Well,
you.
and you know
everybody
what,
loves
that
to be on your,
Sorry, Glenn. He's frozen, I think.
oh,
No?
it broke up.
oh,
It's,
I can hear you. I can hear you and see you still. Um,
oh, there he is.
well, I do appreciate that that we are such a dynamic group, and we encourage each other, we support each other, we motivate each other, we learn from each other. Um, you know, we're all in it together. We know that together we can do hard things.
That's right.
We know that together that we're going to do the best that we can on the day that we've got with what we've got. And we know that exercise is our medicine. And doesn't matter if we're at the beach,
That's
we're
right.
Uh-oh.
gonna we're gonna do the exercise from the beach, or you know, if it's a holiday, we will often meet to do our exercise. It's really important just because exercise is our medicine, and that's gonna make us feel better and do better long term.
Lisa, I
Wow.
hope you realize how much we all
That's true.
appreciate you.
Yeah.
Oh, it's we're a mutual admiration society, that's for
Oh,
sure.
come on.
And which is amazing that we've created these connections over this crazy thing called Zoom. So I would encourage that if there's anybody that's watching this for World COPD Day from another part of the globe that is thinking that they need to provide something for their clients, it works. It works. You just kind of have to, you know, get on Zoom and get out there and talk to people and just start with something, you know, exercise, move our bodies appropriately with our pacing and our breathing strategies, right? Um, support one another, and you know, keep learning about what's happening. There's always new things to learn, always new things out there that can help us. With that, I'm going to say thank you so much to the Keep Breathers for being part of this tonight. And I hope that we help inspire somebody somewhere to
Yeah.
keep going. Keep going.
Thank you.
Thank
Keep
you.
breathing.
Thank you. Thank you. Happy World
Thanks,
COPD
Lisa.
Day.
Yeah, okay.